Hello everyone, my name is Dr. Mario Ademai, and today I'd like to make an informative video on coronavirus. So what is coronavirus? So coronavirus is a new viral illness that can have symptoms ranging anywhere from mild like congestion, runny nose, cough, fever, to life-threatening conditions and complications such as pneumonia or other severe respiratory tract illnesses and infections. So far, there's been 56 deaths and over 2,000 people infected. Three here in the United States have tested positive for the coronavirus, the novel coronavirus strand, including one in Washington, one in Chicago, and one in Orange County in California. There have been international positive cases anywhere from Canada to Japan, France, South Korea, Nepal, Australia, Thailand, etc. The term coronavirus actually is not a new term. The medical community is very familiar with the word coronavirus. Corona actually comes from the Latin word for a crowned virus, and in general, coronaviruses are a group of common viral illnesses that cause cold-like symptoms such as runny nose, congestion, sore throat, fever, etc. However, the novel coronavirus that you're hearing about on the news today is a brand new strain. It's never been seen before. It's thought that it likely jumped from snakes onto humans from Wuhan, China, likely from a live meat market over there. So symptoms of the virus, much like other coronaviruses, cough, congestion, runny nose, sore throat, fever, body aches, shortness of breath, difficulty breathing, GI changes such as nausea, vomiting, diarrhea, etc. The incubation period is defined as the time from when an individual is infected until that individual shows the symptoms. So the incubation period for this new strain of coronavirus is not quite known yet, but it is estimated to be about 14 days. So how does this spread? It spreads much like other viruses: contact with an infected person via droplets, contact with contaminated surfaces. It's likely airborne spreading as well. And airborne is very dangerous because one individual can spread it to multiple individuals around them in the vicinity near them via coughing or sneezing via the droplets. So this is actually a new development. I saw a couple of epidemiologists commenting on this recently, but the new development is that it's thought that people can spread the virus even before symptoms appear, which is very alarming and concerning because that means it makes it very difficult for public health officials or physicians to be able to screen individuals who have symptoms to catch them early on to prevent the spreading. But it's thought that actually there is a risk that it can be spread even before individuals who are infected with it have symptoms to other individuals. Research estimates that those infected with the coronavirus are transmitting disease to 2 to 3 other people each on average, which again is also alarming because one infected individual on average is spreading it to 2 to 3 other people. That's what the thought is as of right now, given some of the data that we have collected recently. So treatment, there is no specific treatment for the coronavirus. There's no vaccine yet, unfortunately, but there are some medical companies that are working to get a vaccine. I imagine probably in the next few months we should have some developments in that regard. Right now, the mainstay of treatment is supportive treatment in a medical facility to make sure that the severe complications like pneumonia and other respiratory illnesses that can be life-threatening don't develop, or if they do develop, to help individuals and help support them make it through that episode in the viral course. What you can do though is this is very important. So as always, practice really good hygiene. Wash your hands really well with soap and water. Disinfect areas such as counters, tables, bathrooms, phones, laptops, etc. Practice proper coughing and sneezing techniques. So always cover up your coughs and sneezes. You can consider face masks for at-risk environments. So this is my personal opinion. I think if you are going to be traveling like on an airplane or going to be somewhere where there's a lot of contact with individuals, since it's still relatively new and since there's still much data information coming about, I think it might not be a bad idea to protect yourself by wearing a face mask, at least for now, until we get more information about the risks for an epidemic spreading of the coronavirus. And lastly, the most important point I want to make with this video is make sure you consult your local doctor if you have any questions, concerns, or any new symptoms that might be worrisome to you that might arise. Thank you so much. I hope this information helps.